Hello everyone. Today we'll be starting another topic from pediatric nursing, that is developmental milestone. So let's start. Development is the functional maturation of the organ, and developmental milestone depends upon neuromuscular maturity, genetic determinants and environmental influence, right? So we know that last session में हम discuss किए हैं कि development is a qualitative change, right? So it depends upon neuromuscular maturity, genetic determinants and environmental influence. So first is physical development. In 6 months, birth weight double, height is 65 centimeter, the head circumference is 43 centimeter. Then in 1 year, birth weight will be triple, right? Then height is 75 centimeter, that is 50% increase in birth weight, birth height. Head circumference 46 centimeter, chest circumference equal to the head circumference, right? Hope it is clear. Then in 2 years, height circumference is 50 centimeter exceed to chest circumference, and height will be double, okay? And in gross motor, in 3 months, neck or head holding that baby will achieve. In 6 months, baby will sit with support, okay? In 8 months, we sit without support. In 9 months, stand with support and crawl. In 11 months, baby will stand without support and walk with support. In 14 months, walk without support. So let's revise it again. In 3 months, that baby will achieve neck or head holding. In 6 months, baby will sit with support. 8 months, sit without support. 9 months, stand with support and crawl. 11 months, stand without support and walk with support. Then 14 months, walk without support. Okay? Up to this. Then 18 months, they will start running. 24 months, climbing upstairs and downstairs with 2 steps. Then control bladder and bowel at daytime. Okay, dry at day. It is called dry at day. So after it is 24 months means 2 years, right? So baby will climb upstairs and downstairs with 2 steps, like 2 steps at a time. Then control bladder and bowel at daytime. That is called dry at day. Then in 3 years, climbing upstairs with 1 step, like adult, right? Like we also climb upstairs with 1 step. So that baby will achieve at 3 years of age. Then riding a tricycle, control bladder and bowel at night time. Then it is called dry at night. Fine. So in 4 years, coming downstairs with 1 step. In this 2 year and 3 year, that baby was going up, right? Now baby has learned to come down with 1 step. Fine. Then jumping, hopping, goes to the toilet alone. Now baby doesn't need any help. He or she can go to toilet alone. Then in 5 years, skipping, become independent, can dress and undress without assistance. So chalo. Then fine motor. Then first one is 3 months. That baby will be having grasping reflex, and that will disappear, right? In 5 months, bidextrous reach for one object with 2 hands, right? Like baby will be holding an object with 2 hands. Then in 6 months, unidextrous reach can transport the object from one hand to another. That is a beautiful picture. Also you can search in Google also as well if you want image memory. Then in 9 months, pincer grasping mature at 1 year. Okay, so what is pincer grasping? Okay, when you are trying to grab an object by only 2 fingers, that is your thumb and index finger, right? So that is a pincer grasp. Okay, that baby will achieve that in 9 months. Then 1 year, that is casting appears, throwing. Okay, 15 months can turn 2 to 3 pages of a book. Like that baby will turn book page 2 or 3 pages at a time. In 2 years, baby can build a tower of up to 6 cubes and also can draw horizontal and vertical lines. Okay, in 2 years, that baby will build a tower. Okay, कितना tower है? वो भी 6 cubes के, ठीक है? And baby will learn to draw horizontal and vertical lines. Then in 3 years, baby can build a tower up to 9 cubes. So 3 cubes add किया है, ठीक है? So that will be 9 cubes and can draw a circle. So how we have remembered? See, 3 na. So if it is 3, it is kind of circle. So in 3 years baby will learn to draw circle. Like that you can remember. Fine. And in 2 years it is simply you have to remember anywhere, that is horizontal line and vertical line, both that baby can draw. In 4 years baby can draw square, right? You can remember like 4 hand. Square is having 4 hands, so baby can draw square at 4 years. And in 5 years baby can draw a triangle. Okay. And in language part, in 1 month, turn head to sound, like alert to sound, right? If any sound is coming, that baby will be turning his or her head. And in 3 months, cooling sound. Okay. Then in 6 months, imitates sound. 8 months, monosyllables words, example ma, ba, like that. Okay. In 9 months, use of bisyllable words like mama, baba, like that. And in 1 year can speak 1 or 2 words with meaning. Fine. So finally in 1 year that baby is speaking, right? Then in 2 years can speak a simple sentence. So baby has learned a simple sentence in 2 years. 2.5 years tell names. Okay. So if you ask that baby that what is your name, that baby can answer his or her name. So in 3 years, no name, age and sexes. Okay, so this is very important. Like they may ask in question that at what age of a child that baby can tell name, age and sex. So that will be 3 years. In 4 years can tell a poem and story. Okay. Then in 5 years identifies various color. Okay. So let's revise it again. In 1 month turn head to sound. 3 months cooling sound. Then 6 months imitate sounds. 8 months monosyllables words, example ma, ba, like that. Then 9 months use of bisyllable words like mama, baba, and 1 year can speak 1 to 2 words with meaning. In 2 years can speak a simple sentence. Okay, 2.5 years नाम बोलते हैं बच्चा, ठीक है. Then in 3 years again name, age and sex सब कुछ बोल लेगा. Okay, then 4 years can tell a poem and story. Then in 5 years identifies various color. Okay. Now coming to social milestone. So what are the social milestone? Let's say in 2 months social smile. Okay. This has been asked in many times that when the baby will achieve social smile. Okay. So highlight this one in a different color, that is in 2 months. Fine. In 3 months recognizing mother. So that baby will recognize his or her mother. Okay, in 6 months smiles at mirror image, present anxiety to stranger. This has been also asked many times, so highlight it. Then 9 months waves hand, hi or bye bye, like that. That baby will show, and that will be achieved by 9 months. Okay. Now by 1 year wave hands to say yes or no. Okay. Finally baby has been achieved that to say yes or no. Then 3 year identification of gender. The baby will start to explore his or her identification of gender. Okay. Then nutritional requirement. Infant needs 110 to 120 kilocalorie per kg per day. In toddler, it is 100 kilocalorie per kg per day. In preschool, that is 1700 kilocalorie per day. Okay. Hello everyone. After comprehensive part of developmental milestone, let's practice some important questions from this topic. So, first question, head control is possible in an infant. So, head control we have already studied, that will come by 3 months, right? So, this will be the correct answer. Okay. So, next question, child sits with support at the age of. So, baby will sit with support, that is 4 to 6 months, right? 8 to 10 months baby will sit without support. So like that you have to remember. Then next question, an infant can sit steadily without support at the age of, as I told in last question itself, that will be 8 months. So 8 months. Option C will be the correct answer. Now question number 357, crawling of an infant occur at? That will be also 8 to 9 months. Okay, so option A will be the correct answer. Then next question, normally a child climbs stair at 1 year of age. So 12 months. 1 year means 12 months, right? So next question, a child can release a toy voluntarily by age of. So that will be by 10 months. Okay. That monodextrous, bidextrous, that particular topic, that is covered by that question. So 360, that is, a nurse is posted in the pediatric immunization clinic. She notices that a child who is very active, he is climbing stair in the playroom, walking forward and turning pages in a book. Based on this observation, what may be the approximate age of this child? So let's see the options. Option A, 18 to 24 months. Option B, 8 to 10 months. Option C is 10 to 12 months. Then option D is 6 to 9 months. So basically this will be like 1.5 years to 2 years. So let's see the option. Then option A will be the correct answer, 18 to 24 months. Right? Then 361, the indicators that suggest that the development is seriously disordered in a child include all of the following except. So except, you have to see the last point, that except, like all are true and one will be false, right? So let's see the option, persistently low muscle tone or floppiness. Option B, persistent toe walking. Option C, no speech by 18 months, climbing stair with 2 feet per step by 2 years. So this is the basically a normal finding. So if child is having a developmental delay or disorder, then this will not be the feature. This is a normal feature, right? So this will be the correct answer. Other options are abnormal. Then 362, a child can walk with a steady gait at the age of. So that will be by 3 years. Okay. A steady gait means a regular manner of walking that will be achieved around the age of 3 years. So you have to read the explanation part as well. So this will be the answer, will be 3 years. Then next question, which of the following behaviors by a 36-month-old child supports a nursing diagnosis of altered growth and development? So let's see the option. Walks holding into furniture, sits down from a standing position, can push and pull twice, throws a ball overhead. So 36 months, what does that mean? 3 years old baby. So that will be a walks holding into furniture, right? Because by the 3 years that child should walk independently, right? So if altered growth and development, then this can be found in that child, that she or he is walking holding into furniture, right? A 3-year-old child can be able to walk and run independently without any support, but here she is taking support basically. Okay, next, at which age a child can start to brush his teeth? So that will be option B, 3 years. A child can start to brush at preschool age, that is 3 years, but with assistance, not independently. Then at the age of 6 years, child can brush teeth self independently without assistance. Okay, now next question, if a 3-year child doing self brushing, it indicate maturity of which age group? So basically 3-year age, if it is not independently, but by 6 year it is independently, so it will be 6 year, option C. Okay, now next question. Okay, when toddlers move around on chair, hands keeping their abdomen off the floor, it called creeping. Okay, so this will be the correct answer, option C, creeping. Then 367, parents of the hospitalized infants should be encouraged to stay with their child to help decrease problems with attachment, risk for injury, separation, anxiety, and failure of thrive. So this will be the correct answer, because in infant, separation anxiety is a major issue. So see, child reaction to hospitalization according to different age group are neonate, they will show impairment of bonding and trusting mother child relationship. Okay, I'm highlighting all this point. So here it will be seeing impairment of bonding. In case of infant, separation anxiety between 6 to 12 months and depression. Okay, in toddlers, protest show by crying and shaking the crib. Okay, this will be protest. Despair, what is that? Show by hopeless, anorectic and looking sad. Denial stage, it showed by accepting care without protest, and regression, that is start to behave like infant. Okay, so that one stage will be, they will behave like a one stage before, like earlier phase of life, they will come back. Okay, preschool child, same like toddler, along adoption of various defense mechanisms. So along with all these features of toddlers, they will show some defense mechanism also. In school age, fear, worry, mutilation and privacy. Fine. Then adolescence, anger and anxiety related to loss of control and insecurity on strange environment, right? Now next question, 368, all the following are child's response to hospitalization. So option A, protest, option B, despair, option C, denial, option D is adaptability. So option D will be the correct answer, adaptability. Fine. Next question, what is third stage of separational anxiety? So we have already studied, right? So first one was protest, then despair, then it will be detachment. Okay, so third stage is detachment. Option C will be the correct answer. Then stranger anxiety develops by the age of 6 months to 12 months, right? So in between we have to answer, that is 8 months. Fine. Then see, here it is also described nicely. Stranger anxiety peak between 6 to 12 months means if a baby become upset when an unfamiliar person approaches them. Separation anxiety means if baby becomes upset when they are separated from their parent. Okay, these both anxieties are linked with development and of an attachment relationship, development of object permanence and cause and effect. ठीक है? By involving the parent in care, separation anxiety can be minimized among the infants. Okay, rooming in करना है मम्मी और बच्चे को एक साथ रहने के लिए, ताकि वो एंजाइटी थोड़ा कम हो जाए एंड मदर एंड चाइल्ड बॉन्ड भी सही रहे. ठीक है, basically that is our goal. Then 371, in preparing a preschool age patient for an injection, the most appropriate nursing intervention is to allow the patient to administer an injection to a doll, coordinate the patient watching a peer receive an injection, have the parents explain process to patient, suggest diversionary activities like singing. So this will be the correct answer, right? So you will tell the baby that you administer an injection to the doll, so that child also allow you to put injection, yeah, give injection. Then next question, during a nap, a 3-year-old hospitalized child wets the bed. The nurse should ask him to help with remaking the bed, put clean sheets on his bed over the rubber sheet. Option C is change clothes without discussing incident. Explain that big boys should call the nurse when they need to wait. So here, change clothes without discussing incident. This will be the correct answer, because basically 3-year-old baby, they are not like, this is normal behavior when they are hospitalized. Fine. See, 3-year-old child shows reaction to hospitalization are protest, then despair, then denial and regression. So bedwetting of a 3-year-old child is normal reaction to hospitalization. So nurse have to change the clothes without discussion the incident. Now coming to next question, knowing that toddlers can be very negative and often use the word not, the nurse who is working with a toddler should offer the toddler only acceptable choices, offer toddler no choice at all, involve the toddler in choices about his care, and option D, read the toddler a book about making choices. So option C will be the correct answer. So you can involve the toddler in choice about his care. Fine. Let's see the next question. Any newly hospitalized patient exhibits increased anxiety because of which of the following reason? Okay, why? Hospital routines and investigation, loss of personal freedom and identity, unfamiliar health personnel, increased risk of infection and unsafe environment. No, this will be the loss of personal freedom and identity. Fine. They can't do everything they are doing at home in hospital, right? So there will be certain rules and regulation that they have to follow, and they should maintain that. Okay, so next question. All of the following are negative experiences of hospitalization except. Okay, negative experience क्या है? देखो option A, pain, assurance and attention, death, complex environment. So what will be the correct answer? Option B, assurance and attention. मतलब बाकी जो 3 ऑप्शन है वो सारे नेगेटिव एक्सपीरियंस है, लेकिन ऑप्शन बी इज पॉजिटिव काइंड ऑफ, एश्योरेंस एंड अटेंशन. फाइन. देन a 6-year-old girl begins thumb sucking after surgery. This was not a child's behavior pre-operatively. The nurse should accept the thumb sucking, distract her by playing crackers, report this behavior to the physician, tell her thumb sucking cause buck teeth. No, this is like accepted. So option A will be the correct answer. The explanation part also, it is given regression start to behave like infant because that baby, that child, she has started to behave like infant and is common during stressful situations. So accept it because it will reduce child's anxiety. Okay. Now next question. Post-operatively, to help relieve the anxiety of young school age child, the nurse should. So post-operatively, to help relieve the anxiety of a young school-age child, the nurse should allow the child time to talk about feelings. Yeah, that seems correct. Then tell a story about child with similar surgery. No, that may not be helpful. Ask the mother to room with the child for a few days. No, that is also not effective for a young school-age child. Then provide the child with bandage, tape, scissor and all. No, that can be traumatic for the child, right? So this will be the first option. Allow the child time to talk about feelings. Fine. Then next, to help parents cope with the behavior of young school-aged children, the nurse suggests that it could help if they would avoid asking specific questions, write a list of expectations to avoid confusion, be consistent and firm about established rule, allow child to set up his or her own routine. Fine. So be consistent and firm about established rule. So parents should fix a rule and that child should follow. Okay. Then at which stage of development are children appropriate to believe in the reversibility of death? That would be preschool. So children below 2 years cannot understand death. Between 2 to 6 years as a deep sleep believe in reversibility of death. Between 6 to 9 years as becoming spirit or ghost, and above age 10 years recognize death as permanent. Fine. In 2 years they won't understand. 2 to 6 years they feel like it is reversible. Then 6 to 9 years they may think about spirit or ghost, and about 10 years old then they will recognize death as a permanent. Then 380, ability of a child to pick up objects with his index finger and thumb is called pincer grasp. We have already studied. Then 381, all of the following finer motor skills develop during early childhood except. ठीक है, फाइन मोटर स्किल्स कौन सा वाला डेवलप होते हैं यहाँ पे पूछे एक्सेप्ट. सो यू हैव टू आंसर कॉन्शियसली, राइट? स्केचिंग, काटिंग, पेस्टिंग, sharing toys, doing jigsaw puzzles. So option C will be the correct answer. Fine. Then 382, the toddler can demonstrate achievement of gross motor skills by which of this activity? So gross motor skill कौन सा वाला? In a toddler it will be push and pull toy. We have studied in the comprehensive part. Then 383, which of the following best describes the language of 24-month-old? Does not understand yes or and no, understands the meaning of words, able to verbalize the needs, then continuously ask why. to most of the topics. So that will be option C. Able to verbalize needs. Then coming to next question, that is, when assessing physical development of a 5-year-old, you would find it abnormal if he needed to go up a stairway one step at a time, could jump on one foot a few times, then could catch a large rubber ball, could stake a pile of 6 blocks. So all these 3 are normal for 5-year-old, but if he or she is needed to go up a stairway one step at a time, but because this is a early milestone, right? Then next question, first sign of sexual maturity in boys, that is increase in height, increase in facial hair, axillary hair, testicular enlargement. So option D will be the correct answer. In boys, sexual change starts with the enlargement of the testes and scrotum, followed by lengthening of the penis. Next, pubic hair appears. The growth spurt starts after 1 year of testes starts to enlarge. So height will be at last. Fine. Now next question, what is the common characteristics of children in middle childhood? Rapid physical growth and development, transition to adolescence, stable cognitive abilities, then decreased social interaction. So this will be the correct answer, stable cognitive abilities. Then people who are born deaf are usually unable to talk. The most important reason for this, because people learn to talk by hearing sounds and language. This will be the correct answer. If you have seen anyone, then you can relate that if he or she is deaf, she can't talk. So this is the basic, because they both are connected in the sense because we learn to talk after hearing only. So that is the answer. So hope up to this all the questions are clear to all of you. See you in next video. Thank you.